bite on sonar. It looks like you are not interested in your own sonar. You are not interested. So the prime time that we're supposed to debate this sonar, you don't want us to take it. Out of the blue, you keep announcing that there's a ministerial statement. Why? We just took a ministerial statement, so defective, not anchored on facts, so partisan. Then you come back again with a ministerial statement. Mr. Speaker, our members have been waiting to debate. If your side you are not ready, we are ready. Let's have our bite. This business of you come, then you make an application, especially for members who only come here when they have business. Mr. Speaker, they know themselves. They come to heckle, and then when they get their way, they leave. Mr. Speaker, we will not accept it. At least engage your colleague here. Mr. Speaker, the practice where the majority chief whip will just get up and announce business, varying business, Mr. Speaker, will not accept it.
Honorable Minority Leader, you are not speaking to the application before us.
Mr. Speaker, that's exactly what I'm doing.
The application is
Mr.
to
Speaker,
have papers presented.
Mr. Speaker, we engage in such circumstances. What we know is that we are supposed to take the debate. The transport minister is a member of this house. He should patiently wait. Let's finish the debate. Mr. Speaker, maybe they are not interested. If you believe in what the president told us, let's get it on the floor. Let's debate it. You're waiting for people to close. It's 5. You want the debate around 7, 8, when Ghanaians have slept. Mr. Speaker, when many people are going to bed, that is the time you want. And we know that trick. It's an old card you are playing. Let's discuss the president's message at prime time.
Honorable members, I intend to vary the order of business. At commencement of public business, presentation of papers. Item numbered 10, which is presentation and first reading of bill. Minister responsible for transport.
An act to prohibit piracy, robbery at sea, and other maritime-related offences, give effect to the provisions of the United Nations Convention on the Law of the Sea in respect of piracy and the International Convention for the Suppression of Unlawful Acts against the Safety of Maritime Navigation, 1988, and related protocols, and provide for related matters.
Yes, Minority Leader.
Mr. Speaker, with respect, the minister who just laid the paper, the rule is clear that upon the request of a member, the minister will be required to give a short explanatory memorandum to the paper is.
Yes, Honorable Minister, a short explanation.
Thank you, Mr. Speaker. Mr. Speaker, the Maritime and Related Offences Bill 2026 seeks to prohibit piracy and also to prohibit robbery at sea and other maritime-related unlawful activities that occur at the maritime sector. Mr. Speaker, we are blessed to have the coast of the sea, and as such, we are serving a lot of the West Africa countries, being in the center of the sub-region. We need to have laws that will be able to provide for the safety, navigation, and safety security on our seas. And as such, we are here with this bill such that we can provide adequately for the safety at sea and also prevent other unlawful activities that occur at sea. Mr. Speaker, I thank you for the opportunity for me to lay this bill today. I thank you, Mr. Speaker.
Thank you so much, Honorable Minister. Yes, Minority Leader. That is his short explanation.
Speaker, this is the House of Parliament. The minister should come to this house, take the house serious with a ministerial statement. Mr. Speaker, we won't accept extempore.
Honorable Minority Leader,
Mr. Speaker, if
with the exercise that we engage in, under what order are you doing what you are doing?
Oh, Mr. Speaker, first of all, I want to understand your question. Mr. Speaker, you mean as I'm requesting for...
A bill has been presented, and you use the rule rightly that the minister should give a short explanation. The minister has given the short explanation. Before the referrer, you are up and you started speaking. That is why I am asking, which rules of the House support what you are doing?
Speaker, with respect, I got up invoking your inherent powers as Speaker. Mr. Speaker, that's discretionary. Mr. Speaker, your inherent powers as the presiding officer is only discretionary. I want your leave to rise under your inherent powers. If that is granted, I will proceed. If that is not granted, Mr. Speaker, I have to resume my seat.
Well, that is not granted.
Very well, Mr. Speaker, that is fine.
Honourable members, the bill is read for the first time and referred to Committee on Roads and Transportation for consideration and reports. Yes, Majority Leader.
Speaker, may I, on behalf of Leader, pray that we go back to statements. That will be item number 8. Oh, please. Can I finish? Please. Speaker, Speaker, may we go back to statements and take a commemorative statement from the Minister responsible for health. Speaker, it's on World Kidney Day, such an important day. So we take a short statement from him, and then we can deal with the outstanding matters in terms of the sonar debate. Mr. Speaker, humbly.
Yes, that is the request.
Yeah, Mr. Speaker, I don't know whether the Majority Chief Whip wants to depart from an unsoiled practice of this House. Mr. Speaker, he has been in minority before, and he knows the value inherent in engagement. You can't just get up because you are vanguard of government business, just announce applications. Mr. Speaker, you cannot. Mr. Speaker, if that is going to be his approach, Mr. Speaker, we would have a difficult time ahead of us. We are sitting right here. Your colleague, the deputy, is here. Mr. Speaker, at least engage him.
Honorable Minority Leader.
Mr. Speaker, if you want to grant it...
Is it not the case that statements are admitted by the speakers?
Mr. Speaker, with respect, can you hear me? Mr. Speaker, don't interject me with questions as if I don't know the rules. That is not the import of my submission. Mr. Speaker, you and I know that at the front bench, we pre-agree on what to do. You know it. He cannot deny the fact that what he is doing now, we are completely not aware. Our colleagues have been seated. Mr. Speaker, he knows that we have been prepared for the debate. And then all of a sudden you say that you have a ministerial statement. It's commemorative. It's only fair that you let us know. That so-called ministerial commemorative statement, we don't even have a copy. Mr. Speaker, we sit here. If that is a new practice because they are in majority, Mr. Speaker, set the precedent. We will talk no more.
Mr. Speaker, please, I can't please. Mr. Speaker.
Yes, let me hear you.
Yes, first of all, it is most inaccurate for the minority leader to suggest that I didn't engage. We had a discussion at conclave. You were not there. We agreed that we would take statements. And before today's conclave, it is contained in the business statement adopted for this week. Please, that ministers of state may make statements. You have been put on notice. Your attitude is that as you engage that you can say no, and when you say no, the business should not be taken. It's unacceptable. Mr. Speaker, we have advertised statements, but the ministers of state, when they have major statements to make, we have to take them. So the suggestion that it is a new approach for me is completely false.
It's a national statement.
You see, honorable members, let us all realize the fact that somebody is in charge of the business of the house. We have a leader of a government business. So if the leader of government business is making a suggestion, I mean, why do we say no? A business that has been discussed at conclave.
Speaker, with all due deference to you, I have always believed that the essence of conclave is to engage on matters of this nature.
Yes.
But we had conclave this morning. There was no representation that there was even going to be any form of statement from the Deputy Finance Minister.
How come I receive
the Minister
those
of Health.
instructions?
Mr. Speaker, so I'm giving you the facts of this morning's conclave. There was none. My senior members have been well prepared to deal with the SONA. Honorable Patrick Bama has been here since morning just because he is going to have the bite of the SONA since morning. There has not been any conversation. So, Mr. Speaker, let's not come and sit here and present a different picture. There has not been any conversation on two statements. One which is commemorative and the other which is propaganda. No. Mr. Speaker, so please, I believe that the essence of going to conclave is to come at addendum that these are the things we are discussing. And Mr. Speaker, even today, we also had wind that there is going to be a program. So there was a possibility of even closing earlier. Why all this? Why all this? They are supposed to have 16 members to have a bite on today's SONA. And we are supposed to have 8. And we are going to do 10 minutes, and they are going to do 5 minutes. And if you add all of that, it's going to be about 3 hours. When are we going to finish, Mr. Speaker? Yes.
Yes, majority people.
Speaker, I believe that the back and forth will eat away more time. So let me urge you for us to proceed and take it's because it's a commemorative statement. I believe that, Speaker, there should be a way of getting the Hansard department to capture the entirety of the statement.
So
within 5
how many comments? How many people are commenting?
Speaker, we can limit it to 1-1, and the leadership will conclude. He can present the statement in 5 minutes.
Honorable Minister responsible for health, you have the floor.
Mr. Speaker, I rise today to draw the attention of this Honorable House to the global commemoration of World Kidney Day 2026, observed under the theme Kidney Health for All, Caring for People, Protecting the Environment. World Kidney Day is an important occasion for raising awareness about kidney disease, promoting early detection, and strengthening national responses to the growing burden of kidney-related illness. Mr. Speaker, kidney disease has emerged as a significant public health concern globally and increasingly within Ghana. Chronic kidney disease, often described as silent condition, progresses gradually and frequently remains undetected until it reaches advanced stages. As a result, many patients report late to the health facilities when treatment becomes more difficult, more expensive, and less effective. In Ghana, the situation is deeply concerning. Current estimates for 2025 place the overall prevalence of chronic kidney disease at between 13 and 19% of the population, representing an average of about 4 million people. This is a significant burden by any measure. Particularly troubling is the fact that the disease is increasingly affecting younger and economically productive persons, with the average age of patients requiring dialysis estimated at 46 years. Mr. Speaker, available evidence from studies conducted at Konfanochi Teaching Hospital further underscores the gravity of the problem. These studies indicate that the highest frequency of renal patient falls within the 46 to 55 age group, representing 19.25%, followed closely by the 36 to 45 age group at 18.96%, and the 26 to 35 age group at 16.5%. This means that kidney disease is not only affecting older populations, but is also imposing a serious burden on younger adults in their most productive years. Mr. Speaker, due to the lack of adequate time, I will want to read the last page and then indulge the Hazard Department to capture as being entirely read. Mr. Speaker, it is important to note that while dialysis is essential in sustaining life, it's often not the most definitive long-term solution for many patients with end-stage kidney disease. Organ transplantation remains most effective long-term treatment option. It is therefore worth informing this House that the Ministry of Health is currently finalizing the organ transplant bill for submission to Parliament. This proposed legislation will establish the legal and regulatory framework necessary to guide safe, ethical, and well-regulated organ transplantation services in Ghana, whilst ensuring protection of donors and recipients alike. Mr. Speaker, let me go to the last paragraph. Mr. Speaker, on behalf of the Ministry of Health and the Government of Ghana, I reaffirm our commitment to strengthening prevention, expanding access to care, supporting patients in need, and building more resilient health system capable of addressing kidney disease and other non-communicable conditions. Mr. Speaker, I'm most grateful, and the Hazard Department must capture it as entirely read. Thank you for the opportunity.
Thank you very much. Honourable members, that is a statement ably made by the Minister responsible for health. It's now time for comment. Yes, Honourable Dr. Titus Bayo.
Thank you very much, Mr. Speaker, for the opportunity to contribute to this statement. And let me thank the Honourable Minister for Health for bringing this important matter to the fore for discussion. And it is important that we celebrate the World Kidney Day, and the theme for this year's celebration, which also captures protecting the environment, is worthy of note. And in Ghana, mentioning of the environment should tell us the impact of galamsey on the prevalence of kidney diseases. And because of time limitation, I'll pray that if we are looking at preventing and reducing the prevalence of kidney diseases, we must tackle the menace of galamsey. The heavy metal poisoning of our water and food has impact on kidney diseases. Mr. Speaker, as mentioned by the Honorable Minister, the prevalence of kidney diseases in the country is between 13 to 19%. And about 300,000 people are estimated to be living with what we call end-stage renal disease. End-stage renal disease happens when you have lost about 90% of the kidney function. The kidney is one of the most merciful organs. It doesn't cause you a lot of trouble until you have significantly lost its function. So you need to lose 90% of the function of the kidney to get to the point of needing dialysis or renal transplant. This gives us enough room for intervention. If we can screen early and identify it, we can prevent ourselves from getting to that level. The leading causes in Ghana are hypertension, diabetes, consumption, unregulated consumption of pain medications, and then consumption of not scientifically tested herbal medications. If we can minimize this, then we can decrease the prevalence of chronic kidney disease, and for that matter, the prevalence of or the requirement for dialysis. Mr. Speaker, I would therefore ask that we emphasize on prevention, because the treatment is expensive. Even where the cost of dialysis is covered by the National Health Insurance, ancillary costs like cost of transportation, medications, drugs like erythropoietin needed to maintain the HB and of these patients, and blood transfusion are all costs that cannot be borne by the National Health Insurance, and these families struggle. For many families today, diagnosis of chronic kidney failure or end-stage renal disease is equal to a death sentence, and we can prevent this if we tackle the early causes of this condition. I would thereby end by pleading that we hasten the process of passing a legislation or a law on organ transplant. The advantages of such a law will be that this transplant will be done ethically. There will be organ banks that people can donate, and people can give advance directives that if they are involved in an accident or anything that causes them to lose their life, they are willing to donate their kidneys. This will permit for cadaveric harvesting of kidneys for use in transplant. In present day, for you to get a kidney donated, you need to get a living donor, and that is very challenging with a lot of ethical considerations. So I plead on this House to really consider, and the Honourable Minister to consider bringing to this House the bill on organ transplantation to help us manage the burden of end-stage kidney disease. Dialysis is not a permanent solution. The best solution is renal replacement. Thank you very much, Mr. Speaker.
Yes, minority leadership. Yes, majority leadership.
Thank you,
Yes,
Mr. Speaker.
you have the floor.
I would like to take this opportunity to thank the Honourable Minister for Health, Honourable Kobna Minta-Kando, for such an important statement. For such an important statement, Mr. Speaker. Mr. Speaker, according to the Minister of Health's statement, 4 million young people, Mr. Speaker, are suffering from end-stage kidney disease. Mr. Speaker, elsewhere, when it comes to kidney disease, it's usually people in their 60s to around 65. But here in Ghana, it is really young people, and for the reasons that the Minister had stated. Mr. Speaker, the most important thing is for a young person, average 46 years old, who has kidney disease. Mr. Speaker, that is very devastating to the patient as well as to the family, because that person has to be on dialysis 3 times a week, and each session is about 4 hours. So Mondays, Wednesdays, and Fridays, that individual has to be in a dialysis unit 4 hours. By the time they finish the session, Mr. Speaker, they are completely wiped out.
because we have to take the blood, pass it through a dialysis machine, and return the blood to the patient. So after the session, there's not much they can do. They cannot go to work and they don't do anything. So they just literally go home and sleep, or they go home and they keep vomiting. Mr. Speaker, having end-stage kidney disease is one of the most devastating diseases that a young person can have. And for the same reasons that the Honorable MP from Lambusi said, Mr. Speaker, it is very important that we pass the organ transplant bill. Mr. Speaker, currently there are two options you have for transplantation. One, as he spoke about, is the cadaveric. When we say cadaveric, Mr. Speaker, we mean from a person who is deceased. Now, the other option is a living-related kidney transplantation, meaning that it is somebody you know, a family member, who now donates you the kidney. Mr. Speaker, every individual has 2 kidneys, and a person can live with just 1 kidney. So living-related kidney transplantation is that somebody will donate one of their kidneys to another individual who is usually a family member. Mr. Speaker, currently we are now doing a lot of kidney transplantations in this country, and that is where Mahama Cares come in, Mr. Speaker. Mahama Cares is doing a lot of specialist training to bring specialists to this country so that people in Ghana will not have to travel outside the country to go to different countries like in the Arab countries or to the US or to the UK to get transplantation. We can do transplantation in Ghana with the right care and with the right facilities, and that is where Mahama Care comes in. Mr. Speaker, incidentally, last month we did 4 kidney transplantation at one of the hospitals in Ghana. All 4 of them were living related, and Mr. Speaker, thankfully, all 4 patients are doing extremely well right here in Ghana. So with Mahama Cares, Mr. Speaker, we can continue to have good, proper health care in Ghana, and we will not have to travel for that. Thank you, Mr. Speaker, for giving me the opportunity.
Honourable members, on your behalf, I thank the Minister for making the statement on this very important issue. Yes, Majority Leader.
Speaker, I believe that as agreed, we can go back to motion number 11, I believe, Mr. Speaker, to continue with the debates, Speaker. Speaker, the other arrangement we had, Speaker, a conclave, because my backlog is quite a lot, we had agreed that our side will do 5 minutes. Each contributor will take 5 minutes, so we can take more of my numbers. The other side had agreed that they will stick to their 10 minutes for committee chairs. So on my side, deputy ministers and committee chairs, every contributor will do 5 minutes, so we can take more. I thank you.
That has been agreed upon. So on the list, I have 16 people and 8 people. Yes.
Mr. Speaker, I have an issue with that. I don't think we agreed firmly on that. Mr. Speaker, we are very much aware that in debates, it is 1 against 1. If we want to divide, we don't want to set some bad precedents over here. That is my candid view about this thing. And so let's look at what has been the standard thing or the standard operation for debates in the House. I don't think we are going to finish in a very short period of time before closure if we adopted that approach to this debate. We on the minority are not in favor of that. arrangement? Thank
Well,
you.
I walk into conclave to meet this arrangement being put in place, and I was instructed as such. In fact, I went further to confirm with Honorable Habib and Honorable Jerry Ahmed about this arrangement when I received the respective lists from the majority and the minority side, and a confirmation was again given. So, I mean, I have some difficulties.
Let me, Speaker, my difficulty is, Speaker, she actually raised this very point before the Speaker.
Yes.
It was the Speaker that presided. Please, Minority Leader, please, if you can. Okay. So she raised the point. Because yesterday we could not go on with the debate. So we brought the backlogs from yesterday to today. Now, my proposal was that because if we stick to 10 minutes for the committee chairs, we may need much more time. So I propose a more reasonable means to getting a lot of my members to contribute. So I shortened my time for them. And so Speaker said her claim that it will amount to setting a bad precedent was untenable, because I was using a more reasonable means to solve my number problems. So it is permissible for me to split my 10 minutes between, instead of giving 10 minutes to one contributor, I was giving my 10 minutes to two contributors. So that is permissible. So Speaker overruled her and approved of the formula before we left conclave.
You see, any time at all, the Speaker is using his wisdom to address a number problem, we oppose it and we run into a problem. So, if one side is going to have 1 hour to speak, and somebody decide that, as for the 1 hour that I'm going to speak, I will let my members use 5 minutes each, and you decide that you want one person to use the entire 1 hour, it comes to the same thing. So how do we address the number challenge when we are opposing this mechanism that has been approved by Mr. Speaker? And when leaving, he has given me a clear instruction that this is what has been agreed upon at conclave.
Mr. Speaker, I think this practice is very alien in this chamber, the one we want to introduce. It is not the same as one person speaking for 10 minutes. We are here, look at the time. I think it's about 5 o'clock, and we are going to engage in this debate using 5 minutes for 16 people on that side, and then, Mr. Speaker, we don't want to set something that is so
in terms
bad.
of time, what difference does it make?
It makes a difference, because before someone gets up to speak, it takes some time before the person begins to even articulate his or her points. It is going to delay us further, and it is not, it's untenable. One-to-one is what we know. It's so alien. And you remember, you recall, Mr. Speaker himself gave a ruling on this floor.
I came to conclave late. I'm unable to overturn Speaker's decision and his instructions to me.
Speaker, so what was a problem for the minority side at conclave was that then those from my side who originally will have 5 minutes will have to be known. So if you see the list I submitted, I indicated those who originally would have had 10 minutes. All of that indicated 10 minutes, but now they'll speak for 5 minutes. And that became acceptable to them. So, Speaker, this issue, so then let's do the 16. I have 16 members. So let's proceed with the 60. You said you cannot get your 16 members to debate today. So you will stick to your 10 minutes, but you will let 8 people that are available for you to speak. How is this difficult? How
Honourable
should this be a
members,
difficult
there is a
thing to
number
accept?
issue. So once it's been addressed this way, let's go by it. Yes.
Speaker, I want to address you on 2 points on this matter. One, I remember some months ago, the majority leader and leader of government business raised this matter on the floor, and the speaker made a definite ruling on the matter that although at committee we go by ratio, when it comes to debate, it is 1 here, 1 there, and nothing will change. As far as the records of this house would bear me out, there hasn't been an appeal to that decision. Now, second, the chief whip of the majority caucus is now putting across a point that now he wants to split his time. So if it is 1 hour each allocated, he wants to split it to make it 5 for each member. So if it's an hour, instead of 6 people, he wants to do 12 and split it. Mr. Speaker, much as he may have his own good intention to solve his problem, that is not the practice of Parliament. Now to suggest that we had said we don't have 16 people, so we only yielded to 8 because we don't have the numbers, and he has 16, and therefore we should bring our 16, so he brings his 16. Mr. Speaker, that is a different argument. If we need more time to debate SONA because you have members who would want to speak, let us discuss that and then agree. But as it is, we've agreed that tomorrow leaders are supposed to close the debate. If we want to extend it to Friday, we can do so. But Mr. Speaker, I don't want us to weave a certain precedent that would come and haunt ourselves in this chamber. Mr. Speaker, it's not a matter of speaker has ruled. Mr. Speaker, you've spoken, Honorable Defemepo, listen to me. What you are trying to suggest is to use a backdoor. I don't want to use a Kokwanansi approach. Have 1, let me take 2, but it's the same sharing formula. No, it will not be the same. It is Kokwanansi's strategy. He said, oh, you have 1, let's share. Have 1, mine, I will split it. When you split, they are not the same. When you split, they become 2. If we are doing 1-1, if you have your 8, do your 8 for 10 minutes, we do our 8 for 10 minutes. If you want to do 5-5, let's proceed with 5-5. But I'm pleading with you, this thing that because you are in majority today, you want to have a full house, take the full loaf. You can never predict what will happen tomorrow. And I am saying, Mr. Speaker, that is exactly what it is. Okay, Mr. Speaker, he makes it clear now to me now. He has 16, I should look for my 16. Mr. Speaker, that is fair enough.
You see,
if that is his argument, then that's fair enough. But I won't accept any ratio of 2 to 1 because there's a ruling on it.
Honorable members, the said ruling was delivered by Mr. Speaker.
In this very chamber.
And Mr.
It's a matter of public record.
Can you listen to me too? Mr. Speaker was at the conclave when these arrangements are made. I am unable to vary same. He can come later and vary same, but I am unable to vary what has been decided. That's the difficulty that I have. If it is the case that we'll take 8 people for today having regard with the time, everybody speaks 5 minutes, then I'm still within the range.
Mr. Speaker, fair enough. If the 16 is not working, because the majority chief whip is proposing 16-16 or 5 minutes each, we don't have a problem with the save that. The remaining 8 can have a bite. Mr. Speaker, let's not. This is not the first time that one side is having majority. We have had 169 before. Honorable Majority Leader, we have had 169 before. That is not how we treated your minority. We have had 169 in this chamber before. 169 was a number.
Mr. Speaker, I think you've concluded who ruled earlier on against my proposal that we have some kind of proportional opportunity on SONA and even the budget. He decided to make some approvals that will be more accommodating, so that they maintain the length of time they get to debate. We enjoy the same length of time that we get to debate, except that we use numerous debaters. I don't see why you should have a problem. The from you is that the numbers are not important. The substance is what is important. So don't worry. If 20 people on this side speak for 30 minutes and say nothing valuable, if only 7 people on this side speak for 30 minutes and say something very valuable, your own argument that substance is what is important will prevail.
So let's accommodate one another. Speaker has already made the arrangements and communicated it to First Deputy Speaker. And as he indicates, he has to go according to that arrangement. Let's try it today and see how it goes.
Speaker, with respect, I don't want my colleague to quote me out of context. I don't want him to quote me out of context. Mr. Speaker, I maintain that the majority is taking an undue advantage of their numbers. This is not an end to the democracy we have. There's an election ahead. We have had 169 in this chamber. We did not bring such arguments. Mr. Speaker, this hours I will subdivide into 2. Mr. Speaker, it's not the same. Mr. Speaker, it's a backdoor approach. And I also don't want Mr. Speaker himself to be quoted in public, because Mr. Speaker has ruled. And anytime I have administratively approached Mr. Speaker on matters that I felt administratively motion, if the House decides, it's only through a proper application on the floor that same can be varied. Mr. Speaker, I don't want to believe.
Minority Leader.
Mr. Speaker, can I conclude this?
I don't want you to be doing that invitation. I just want to acknowledge.
Mr. Speaker, you hold on.
Cannot always be by bring a motion.
Why? But the majority leader spoke. He didn't interrupt. At least let me finish so he can come in. He has unended opportunity to admonish and come in. The majority leader spoke. There was no interjection. Mr. Speaker, what I am saying is that the speaker should not be invited into this matter. Matters that perhaps is discussed at conclave, we shouldn't create on them. I don't want that impression should be created. Mr. Speaker, I am ready for a workable approach. The majority chief whip has suggested that we do 8-8 and continue tomorrow. You say you want us to do 16-16. That's fine. If you want us to do 16-16, Mr. Speaker, if that is a suggestion, we are ready
would marshal our 16. He should get his 16 ready.
Very
Let's
well.
start.
Everybody speaks for 5 minutes. Starting from the minority side, I will give the floor to Honorable Patrick Boama. You are speaking for 5 minutes.
Thank you very much, Mr. Speaker, for the opportunity to make some few comments on the President's message to the House. Mr. Speaker, the President came here to perform his constitutional duty in accordance with Article 67 of the Constitution. Mr. Speaker, this 5 minutes is not going to make this debate interesting, but I will make some points and sit down. Mr. Speaker, the world is going through some turmoil. We're experiencing some hikes in petroleum. Oil is now, we've been promised a resilient economy, and we trust that no excuses will be brought to the floor when this affects our national budget. Mr. Speaker, we just read a report by a think tank in education in this country, that's the Education Watch, that over 30,000 basic schools or classrooms have remained without teachers since 2025. This is a worrying statistic that every serious government must take a closer look at, Mr. Speaker. For want of time, I will not go into detail because it affects the very progress of our kids in the educational sector. Mr. Speaker, public sector workers have all been agitating for better wages, Mr. Speaker. The President addressed to this House, we did not hear much about his plans and his strategy to assuage the difficulties being meted out to public sector workers. Today, CLOSAG is on strike, and today for the single spine salary structure, some workers have as high as 53% allowance on their basic pay, while their counterparts in funds. This is close to over 53% allowance, and PSU has 0%, Mr. Speaker, and there is serious labor disconnect or discrimination that has to be looked at. There is so much labor agitation, and we don't want a disruption in the labor front, Mr. Speaker, and the government, being so caring, as they say, should take the right steps to address these agitations on the labor front. Mr. Speaker, Mr. President also mentioned that Ghana was ready for business, but in a country where utility prices keep changing by the day, by the week, by the hour, it's not interesting for any business to thrive. Mr. Speaker, I took a glance at the Fraser report on mining, in the mining sector, and the Global Investment Attractive Index for 2024. Ghana ranked 46 out of 82. In 2025, Ghana ranked 53 out of 68. 2024, in the Global Policy Perception Index, Ghana ranked 46 out of 82 and 50 out of 68. So, Speaker, the Global Best Practices Mineral Potential Index, Ghana ranked 34 out of 58 and 35 out of 41. Mr. Speaker, I took a very close look at the NDC manifesto, and I've noticed that the President failed to report on the establishment of the National Bank for Women, National Women's Bank, to support female entrepreneurs on page 12 for the NDC manifesto. Mr. Speaker, there wasn't any report on the establishment of the cocoa colleges in the cocoa growing areas to train cocoa farmers and extension officers, as stated on page 41, Mr. Speaker. Mr. Speaker, tariff increases as a major feature in the last statement by the President.
I will then give the floor to Honorable Sanja Nanja.
Seconds.
You have the floor, Sanja Nanja.
Thank you, Mr. Speaker, for the opportunity to comment on the motion that was ably moved by the Honorable Member for Bolgatanga Central, that this House thanks His Excellency the President of the Republic for the message on the state of the nation which he delivered to Parliament on Friday, 27 February 2026. Mr. Speaker, over the years, illegal and irresponsible mining, aka Galamsey, has been a major problem facing our nation, Ghana. But unfortunately, government after government has failed to combat this canker. Mr. Speaker, two related factors have been identified as the inhibiting factors not allowing the Galamsey fight to succeed. And these are weak enforcement and lack of political will. Mr. Speaker, the President in his State of the Nation's address reaffirmed his position to fight Galamsey. And he stated that the focus is now on the big fish and not the lower offenders. Mr. Speaker, in 2003 and 2004, 2023 and 2024, out of the 845 persons who were arrested in relation to Galamsey, it is sad to note that the previous government only prosecuted 35. At 35, that is 4%. And the breakdown is as follows. 2023, 218 were arrested and only 24 were prosecuted. In 2024, we have 627 arrested and only 11 were prosecuted. Mr. Speaker, the President has said in the State of the Nation address, has declared that no excavator will be missing this time round. We remember 500 excavators in the previous government were seized, and these excavators miraculously grew wings and flew to and flew out of the country, and up to date we can't find them. This time round, the excavators are tamed. The excavators can no longer fly because we have taken measures, and the excavators, tracking devices have been put on the excavators, and they are being monitored wherever they go. Mr. Speaker, recently, just last week, over 1,000 chamfans which were bound to Galamsey areas were intercepted at the Tama Harbor by the EPA. And this is a boost to Galamsey fight. Mr. Speaker, if you go to the Galamsey areas, Galamsey prone areas, there are hundreds of cases pending at the courts. Mr. Speaker, the President and his team have deployed specialized prosecutorial teams to go and fast-track these cases. And the most thank you, Mr. Speaker, for the opportunity.
I proceed to give the floor to Honorable Kennedy Osei. Kennedy Osei Nyako. Honorable Frank Yeboah. You have 5 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Speaker, for the opportunity to comment on the President address that was delivered to us on the 27th of February 2026. Mr. Speaker, listening to the President's speech,
Second Deputy Speaker should take the chair. Please continue.
One would safely assume that Ghana has suddenly become a paradise for healthcare delivery. But, Mr. Speaker, that is not the case. On the issue of nursing, the President boldly declared, and I quote, "Nursing training allowances have been regularized, application fees reduced, and the no-fee stress initiative introduced to ease access to training." End of quote. The emphasis on ease access to training, very comforting words, Mr. Speaker. Mr. Speaker, while the President was in this chamber delivering these sweet words and comforting words, the Minister for Health, Honorable Minta Kando, was at Nairobi aggressively causing the suspension, immediate suspension of the Nairobi Training College principal, Nursing Training College principal. What crime did this man commit? The Speaker, the Minister is saying that the man admitted 2,750 students against the government's approved cap of 750. The Speaker, against the 750, the justification the Minister gave was that it will burden the government's no-fee stress and also affect the payment of allowances. The Speaker, I asked the House, sincerely, is it an achievement to deny 2,000 students who are qualified admission to nursing training college because the government or the president wants to save face on a populist campaign promise made to Ghanaians in 2024? Mr. Speaker, Mr. Speaker, if we want to look at the true state of health sector in Ghana, then we have to look at the cocoa farmer in my constituency in Achumango Bedanof, Rapong, the cocoa or Sefibodi in the Western North region. That cocoa farmer, Mr. Speaker, that cocoa farmer had assurance. Mr. Speaker, that cocoa farmer had assurance of a life-saving anti-snake serum delivered swiftly by zipline drone system under the previous government. But today, Mr. Speaker, that assurance is gone because the government has suspended the contract between the government and the zipline. Mr. Speaker, today, if that cocoa farmer should go to his farm and gets bitten by a snake, the farmer will have to find his own way of getting transport to the nearest hospital before the anti-snake serum will be administered. And where is that money going to come from for the transport? The money is going to come from the same proceeds from the sale of cocoa beans that the government has slashed over 1,000 Ghana per bag. Mr. Speaker, and if that farmer is able to get to the hospital and get the serum and returns back, the Speaker, the farmer is going to meet with Dumso because Dumso has returned, or the 100 CD prepaid credit he bought 2 days ago that used to last for 2 weeks. Or for unfortunately that just lasted for 2 days, and therefore the Dumso and the farmer will find it difficult to administer the medication that was given to him by paramedics. The Speaker, this is the true state of our health sector now. Ghana for Yaya Mobo and the NDC. The Speaker, to it, Ghanaians are suffering under NDC. God come to our aid. Thank you, Mr. Speaker. Thank you.
Thank you very much. Let me now turn to Honorable Frank Efie, member for Afajeto South. Honorable, you have 5 minutes.
Thank you very much.
Time starts now.
My most revered Speaker, while sharing my perspectives on the President's message on the state of the nation, permit me to convey multitude of gratitude and appreciation to HE, the President, for delivering what has globally been accepted as a magnificently outstanding, evidence-based, sector by sector, blow by blow, detailed but significant account of his stewardship to the people of this country. Mr. Speaker, when we talk about research, this is the evidence of the research that we've talked about. Speaker, our governance is meaningless unless it delivers concrete, impactful, purposeful outcome to its citizenry. Speaker, we have crafted the Local Governance Act just so the 40% of our compatriots who live in rural settings will be taken care of. Speaker, through your facilitation, I just returned from the Western and Central region as a member of your noble committee on rural development and local governance. Speaker, I was extremely excited at the rate of development we are witnessing under His Excellency John Dramani Mahama. Speaker, when our colleagues across the aisle had opportunity for 8 good years, local governance was reduced to mere devolution of power and deconcentration of offices. Can you imagine? Speaker, today, His Excellency is giving true meaning to local governance. Today, the district, metropolitan, and municipal assemblies are well resourced. Speaker, I'll give you a tangible example. If you go to Western region, there is a municipality called Efia District. Speaker, in the year 2024, under the reign of His Excellency Akufo-Addo, the whole year, that municipality had only 2.7 million. Today, under His Excellency John Dramani Mahama, the same municipality for 1 year had 26 million. Speaker, look at the yawning gap between 2.7 and 26 million. No wonder they are delivering. They are performing efficiently and effectively. Mr. Speaker, this is what we are talking about when we say we need to incentivize our local base, create jobs, and unleash opportunities. This is what John Dramani Mahama is doing. But Speaker, most importantly, I want to also put on record that this government is not on autopilot as we have had in the last 8 years. The government is being regulated. There are guidelines for spending these monies. So there is a formula. And so the amount of money that has been sufficiently delivered, a section is supposed to create school desks for our pupils. Research and data by EduWatch clearly shows that 2.3 million of our pupils in public schools in Ghana lack desks. Speaker, that is why His Excellency has directed that a segment of this money be used to create desks at the district level. Speaker, a network of Safe Water and NGO has revealed that 44% of Ghanaians lack access to safe, clean, potable water. His Excellency has directed that a percentage of the money to the various assemblies be used in drilling boreholes and creating water. I am excited to know that whilst we were in the Western region, Mr. Speaker, significant amount of these boreholes have already been drilled and mechanized for our people. So by rough estimate, by 2028, we will be drilling about 5,000 boreholes. This should be enough to give about 500,000 Ghanaians access to safe, clean, potable water. Anyone who gives water gives life. Mahama is giving water.
Mahama is giving cheap compound. By the time we go to 2028, Mr. Speaker,
we would have built about 500 plus cheap compound so that every Ghanaian can have access and take advantage of the free medical care policy of John Dramani Mahama. Speaker, this is the governance we are talking about.
And if you indulge me, I'll use the hazard of this House, and particularly, Mr. Speaker, in reference to today, I call him Bishop Kofi Amagwa. Speaker, the last sonar that President Akufo-Addo delivered to this House, this was his response to President.
Thank you. So let us wifey.
Thank you.
You have 5 minutes.
Yes, sir, thank you. I rise to comment on the State of the Nation address ably delivered by the President in this respected House. The Speaker, I would like to draw the attention of this august House, the fact that Ghana is still the host of the African Continental Free Trade Area that has come to stay. The African Continental Free Trade, which is a very important concept of a customs union that Africa has adopted, is being hosted by this country. And for that matter, we have to respect the dictates and protocols of AFTA. The Speaker, the President in the State of the Nation address clearly made a statement that he wants to encourage a new policy called an export policy to help the country to be able to focus attention on intra-African trade. We believe that the African Continental Free Trade Area has come to bless Africa so that we'll be able to trade amongst ourselves, duty-free, quota-free. However, Ghana as the host of this concept must be seen as a champion, not just a participant. We have to show leadership. And showing leadership means that we have to do things to be enhanced. African Continental Free Trade Areas SME Readiness Program will also come into force. These are things that we were expecting to see in the country, but in reality, these are nothing. You cannot find it anywhere in this country, which means that the country is not positioning itself well to take full advantage of the African Continental Free Trade. As at now, out of the 55 African countries, 54 African countries have signed the agreement. 48 African countries have ratified the agreement. I believe that as a country, we have to be seen to be so serious about the African Continental Free Trade Area. The Speaker, it also interests you to note that the President made a huge announcement that has come to just be a mere announcement, announcing that there are going to be 3 government factories to be established within this country. 3 government factories. The Speaker, this was just an announcement. As at now, nothing seriously has been done as far as the establishment of these factories are concerned. I can confidently tell you that preparatory works are only underway. There hasn't been any serious engagement with the Ghanaian that has been selected to take the lead or promote the business on behalf of Ghana. So I believe that this was just an announcement. It didn't show anything serious, and it didn't speak well of us as a country that is ready to create a lot of businesses. But Speaker, to interest you to know that the President said that that factory is going to create about almost about 1.7 million jobs, total factory work, which I believe it would have encouraged a lot of people to even be part of the whole arrangement. But government alone, as government, may not be able to do it. Note that the 24-hour economy that they were trying to bring could have helped in this matter. If they had allowed the private sector to come in, the private sector could have come in by also leading to set up government factories. In this country, as I'm talking to you, there are 3 major government factories in this country that employs almost about 500,000 people total. If you combine both direct and indirect jobs that they create, I believe that the government should have done more by engaging the private sector, giving them good incentive package that can encourage a lot of people to take part of this program. The next point that I want to talk about is the fact that the President declared the country as being ready for business. Being ready for business means that we are ready to open up we are ready to also share data. One of the key things that the president didn't do was to give us data on specific investments, especially foreign direct investment that we have attracted into this country. As at now, the president and any other person here cannot specifically tell us how much more money we receive as a country in attracting foreign direct investment into this country, which is not too good for us as a country. So any foreigner who wants to invest in this, into this.
Thank you, Honorable Mike Ebefi. Let's turn to Honorable Bate Zedin. Honorable Bate, you have 5 minutes.
Thank you very much, Right Honorable Speaker, for the opportunity to contribute to the debate on the message on the state of the nation delivered by His Excellency John Dramani Mahama, President of the Republic of Ghana, Commander-in-Chief of the Ghana Armed Forces, pursuant to Article 67 of the 1992 Constitution. Mr. Speaker, let me begin with the issue of roads. Roads are not merely infrastructure. They are arteries through which opportunity flows to our people. When roads improve, markets expand, farmers prosper, and communities move from isolation to participation. If we are serious about agricultural transformation, then we must equally be serious about the roads that carry food from our farms to our markets. Mr. Speaker, the President announced the construction of the Accra-Kumasi Expressway during his address. And Mr. Speaker, let me state that this is not just another road project. This is a corridor in the history of this country, comparable only to the famous Accra-Tema motorway constructed by the first president of the Republic of Ghana. Approximately 198.7 kilometers connecting Accra to Kumasi, and leadership, and not cynicism. Mr. Speaker, I say this with personal experience. A few weeks ago, I had the privilege of attending a parliamentary training workshop in the Philippines. While there, I experienced firsthand what modern expressway infrastructure can do for a nation. Mr. Speaker, the Philippines has 7 major expressways, not one, with 2 prominent ones being the North Luzon Expressway, otherwise known as NLEX, and the South Luzon Expressway, otherwise known as ETLEX. Some sections carry between 4 to 8 lanes, and other sections carry as many as between 11 to 13 lanes. Mr. Speaker, the Philippines has a population of about 120 million, and Manila, the capital, has a population of 30 million. And yet, because of this wonderful road network, it is relatively manageable for movement to be carried out in that particular country. Mr. Speaker, let me move to the big push. This initiative will ensure that strategic roads across all city regions of Ghana will benefit from accelerated infrastructure development. And I'd like on this occasion, on behalf of the people of the Upper West region, to express profound gratitude to the President for including critical roads in our region under this program. Mr. Speaker, historically, the Upper West region has not received much infrastructure development. In fact, at some point in time, road construction, we had the least kilometerage of paved roads in the country. And so we are very for including us in the Big Push road program. Mr. Speaker, the roads which have been included include the following: Solagwa Road, Navrongo Sicily Tumu Road, Tumu Hengwa Road, Tumu Heng Lora Road, and then Wahamli Road. Mr. Speaker, These roads will certainly open up the Upper West region. Let me, Mr. Speaker, move to aviation, that is transportation. The President announced the construction of 3 new airports, including the Wa Airport. Mr. Speaker, let me say that I was privileged to be part of the team that acquired the site for the new airport, that is at Perisi. And this was in 1995. The people have been waiting for the construction of.
Honorable Bid, thank you very much. Let's now turn our attention to Honorable Tia Kabiloisi. Very well. So let's move to Honorable Kingsley Ajimai. Honorable Kingsley Ajimai, you have 5 minutes.
Thank you very much, Right Honorable Speaker, for the opportunity to make some few commentary on the State of the Nation addressed by His Excellency the President. Listening to the debate and the commentary from the other side, one begins to wonder if it is really the State of the Nation that the President presented to us. Mr. Speaker, if you indulge me, I want us to go to page 11 of the President's address, specifically paragraph 2, and I want to paraphrase or quote him. He says, "Our nation is on the runway. It is in takeoff mood, and you are all advised to fasten your seatbelt," unquote. Mr. Speaker, this means that it has taken the President 15 months, if he was a captain of an aeroplane, to just push back and taxi to a runway. I mean, it is not surprising that headliners or frontline policies that they mentioned in their manifesto, such as the big push, which they are debating around as perspectives or perceptions and not realities, has not seen the light of the day. Their famous 24-hour economy, the expected number of employment that they ought to have done, have all not materialized, because for 15 months, the President was pushing back to taxi to a runway. So if you have a flight duration of, let's say, 4 hours, you have used basically 1 hour or 1 hour, 30 minutes just to push back and taxi to a runway. I believe this is not the way to go, and that we have to be more serious with the way we govern our country. Mr. Speaker, the President's statements or address was interposed with a lot of levity. Why do I say this? If you go to page 27, where he sought to address a problem, and for permission, I quote, "Today, NCD accounts for over 40% of all deaths in Ghana and remain a major case of household. 1 out of every 2 deaths that happens in this country is as a result of an NCD. A very big problem, huge problem, that if you are a president of a country and you are confronted with a situation where 1 out of 2 deaths happens and it comes from a categorization of the public health called an NCD or non-communicable disease, and you will laugh at this. His solution to this huge or elephantine problem was the creation of a Ghana Medical Trust Fund, what all of them are alluding to as Mahama Cares. Mr. Speaker, you have this huge problem that you are confronted with as a president. Your solution was to take 80% of this fund coming from an existing fund that you're already struggling with. That's the 20% from the National Health Insurance Authority. I mean, big problems require big solutions. And for this solution that has been suggested or has been addressed by the President in this State of the Nation address is very, very, very unfortunate. Mr. Speaker, we cannot continue to behave, or we cannot continue this way. How can you take 80% of a fund from an existing problem or a problem that is killing 1 out of 2 deaths that happens in this country is as a result of an NCD. Why this? I think there should be more. There should be more rigorous financing when it comes to healthcare. The mere fact that you want to etch your name in what President Kufuor did by bringing about economic accessibility to healthcare, where no one is denied healthcare because of their low socio-economic setting, does not mean that you should be in a hurry. It does not mean that you should be in a hurry to bring about something. I mean, policies must be very thoughtful, and we must take the people of this country very serious. 1 out of 2 deaths cannot be solved by bringing about what they call Mahama case. Thank you very much, Mr. Speaker.
Thank you, Dr. Kingsley Nyako. Kingsley Ajiman. So we turn to Honorable Ni Ashikoti. Honorable Ni, nobody will interject you. You have 5 minutes.
Thank you very much, Mr. Speaker. That you don't allow anyone to heckle me. Mr. Speaker, I also want to take the opportunity to thank His Excellency, the President John Dramani Mahama, and also to the Venerable Atufosin for the great work he's doing in Ghana's economy. Mr. Speaker, I wonder why lately, when matters of the economy, our colleagues are quick enough to jump on matters of cocoa and cocoa farmers. Mr. Speaker, I have in my hands a statement on statement made today in this House as part of the Auditor General's report. And Mr. Speaker, in this document, without prejudice, it is being alleged that about 18 billion Ghana cedis is at large. And what I want to say, this to cushion the cocoa farmer. What we are doing today is to manage the mess they created. Mr. Speaker, His Excellency John Mahama has managed the economy so well that today, inflation is as low as about 3.5. This is gradually reflecting 3.3%. It's far less than what we would have used to do same under the NPP. He knows that Ghana as a country need to shock absorb its economy so that the gains we have made so far will not derail. And that is why Ghana accelerated National Reserve Accumulation Policy, which was brought to this House to be approved. What is the purpose? It is to ensure that we'll be able to accumulate about 15 months of import cover by 2028 to shock absorb Ghana from any external insecurity. The Akufo-Addo-Bawumia-led government didn't have this foresight. When COVID struck, they found themselves wanting to the extent that they have to run from one country to another, borrowing everywhere, and to the IMF and all the other Bretton Woods, just begging. But we are being proactive to ensure that we build Ghana's base to the extent that whenever there are any external shocks, we'll be able to manage that. Under the NPP, they made the Ghanaian lose confidence in that famous phrase, what I call the phrase of destiny, in Dr. Kwame Nkrumah's independence delivery, that the black man is capable of managing his own business, his own affairs. They made the Ghanaian lose so much hope that the Ghanaian thought, no, we blacks cannot manage our own affairs. But today, thanks to His Excellency the President, John Dramani Mahama, who has brought hope to the lives of the Ghanaian, who has made sure that MMDAs are receiving whooping amounts of monies they haven't seen in decades. Today, the Ghana Medical Trust Fund that he is referring to has come to stay. But Mr. Speaker, if they knew that this is how bad NCDs is affecting our people, what did they do during their times? Today, as we speak, 6 new regional hospitals are being built in the regions they created and left the people to suffer. Mr. Speaker, today, the La General Hospital is being built. Mr. Speaker, today, Mahama Care is here to save lives. Mr. Speaker, Nkoko and Kitinkiti is also here to stay. We will develop this